So you said, I know we have,
You, Steve, Valerie, Michael, and Mary logged in.
okay.
And if I
So,
missed anybody, please let me know. I apologize.
yeah, so we've got a quorum. We're missing Eddie Reynolds and TJ Lidovic.
Yes.
Yeah, okay. Let's give everyone another 30 seconds and then we'll get started. Thank you very much.
You're welcome.
Sheila, this is Abby. I'm joined by phone. I'm heading back from another city, so
Yeah.
I'll listen.
Okay, great. So that's Abby Drain from Seven County Services. Glad to have you, Abby. Safe travels. We have about 65 people on.
It looks like TJ just joined as well.
Oh, good. All right, thank you. So we have 6 of our 7 members, and perhaps Eddie Reynolds will be able to join us. So let's call the meeting to order. As the pilot says, when you're getting ready to take off, if you're not headed to the BH TAC meeting, you're on the wrong plane. So we welcome you all and wish you a happy new year. And we'll hope that 2023 is a better year health-wise and calamity-wise than 2022 was. But we have weathered those storms together. And let's have the voting members of the TAC introduce themselves. So Val?
I'm Valerie Mudd with NAMI Lexington, the National Alliance on Mental Illness and Participation Station, a peer-run, peer-operated center. I'm representing the consumer voice.
Great, and have been from the beginning. Thank you, Val. And Mary Haas?
Okay, Mary Haas with the Brain Injury Association of America, Kentucky chapter. Longtime advocate, I'd probably say around 30 years. So anyway, glad to be here.
Glad to have you, Mary, and your vast experience. Mary and I have been in the trenches together for a long, long time, and we appreciate that. Mike Berry.
Hi, everybody. Mike Berry, People Advocating Recovery.
Great, and Mike has been with us since the beginning of the TAC. And TJ Lidovic.
Good afternoon, TJ Lidovic, Strategic Advisor and Advocacy Coordinator for NAMI, Kentucky.
Great, and thank you for joining us, TJ. And Steve Shannon.
Steve Shannon with CARP, Association of 12 Community Mental Health Centers.
Wonderful. And I'm Sheila Schuster, Executive Director of the Kentucky Mental Health Coalition and Chair of the TAC. So when we call for motions and votes, that's the voting members. But for open discussion, we can open it up to anyone who's on the call with questions or comments, or you can put things in the chat, however you would like to do that. I've been accused of being the godmother and now the grandmother of all coalitions, which is probably true, but we like to invite everyone in the behavioral health community to be a part of this. So thank you for your attendance. I just sent out the minutes, and I'm sorry they were quite lengthy. I got kind of wordy with them, but if I could have a motion from one of the voting members to approve the minutes, please.
Mary Haas will so move.
Thank you, Mary.
I'm sorry, this is Kelly. And for voting purposes, all members have to have their cameras turned on.
Right, all of the members, all of the voting members of the TAC need to have their cameras turned on. Yes, thank you, Kelly. And I should introduce, Kelly, you want to introduce yourself, please?
Sure.
Is our helper?
Yeah, my name is Kelly Sheets, and I have just moved into the role of federal program specialist in the commissioner's office for DMS. I have been assigned to kind of help Erin. As you all probably know, she'll be going on maternity leave soon. So I will be taking over at that point. So it's very nice to meet all of you and to work with all of you.
Thank you, Kelly, and it's been great to have you as a backup with Aaron and to get to know you through email and so forth. So we appreciate your being with us.
Thank you very much.
So Mary Haas made the motion to approve the minutes. Do we have a second?
I'll second. Valerie.
Valerie second. Any additions, omissions, corrections in the minutes? If not, all of those in favor of approval signify by saying aye.
Aye.
And opposed, like sign, and abstentions. All right, the minutes are approved. I don't know if Claire Arendt is on or if any of the KHA people are on. We've had this as an ongoing item, and that is whether the provider credentialing through KHA and Verisys has the system gone live? Does anybody know? So I assume that the MCOs who are participating also don't know if the system is live.
This is Kathy Jones. I did see some notes recently that we were submitting credentialing to Verisys. So I'm assuming based on that information that it is live. I can follow up for sure. And this is Kat with Aetna.
Oh, okay. Thank you, Kat. Yeah, I would appreciate it. And I'll get with Claire Arendt later too with KJ, because we've been waiting for this provider credentialing. And I think they presented at our September meeting and everybody was quite excited about it. And then it was going to be live maybe in November. And then at the November meeting, it wasn't quite live. So hopefully that is happening soon. So thank you, Kat. I appreciate that. The next item is something that we have been working on and have had on here off and on for the past, what, Steve, year and a half probably?
Yes.
To do a study of the Medicaid data with regard to the impact of targeted case management. And I think I announced at the last TAC meeting in November that we had 2 sets of data. Now we have the set that Medicaid staff pulled for us on various variables. And then we have kind of a finer grained and more expansive analysis that was done by the data analytics people over at UK. I'm going to table this until our March meeting because we've been waiting for Commissioner Lee to be briefed by the UK people. This was her initiative, if you remember. There was some dispute about whether targeted case management was helpful or not. And she said, let's get the data and find out. I will tell you that the preliminary results, actually the results we have from both of these studies indicate that it is impactful in a very positive way for our people with severe mental illness. But I'd like to be able to really have a good presentation for you of that data. And I don't want to do it without the commissioner having been briefed about the data. So we will hold that over to our March meeting. And I apologize for the delay, but we want to be sure that we get this right. And since it was the commissioner who initially set out the study and gave us permission to work with her data people, we want to be sure that she's a part of that discussion. Mary, I think this next issue is yours. You had wanted to put this on the agenda for this meeting, and that has to do with the loss of access to therapy services for individuals served by the ABI waiver. And you might give a little background for people who might not know that there actually are 2 ABI waivers.
Okay.
Short-term and long-term, but take it away, please.
Okay, the first ABI waiver is actually referred to as the acute waiver, and it was initially intended to get people as soon as they were out of the Fraziers and the Cardinal Hill rehab centers, and really was targeted to get them up and about. And because a lot of times insurance companies are only paying for 12 to 22 days of therapy. So this was a way to continue them and getting them back onto the road. And then later on, we found that a lot of our folks were going to need continuing care for probably the rest of their lives, just due to the deficits and the severity of the brain injury. And that's referred to as the ABI long-term care waiver. And there had always been therapies in the waivers. And for people who don't know, this is how our folks get better, is the speech therapy, the intense occupational therapy, and physical therapy, depending on how severe the injury was. Not all people require physical therapy, but all do. For cognitive rehab would need the speech and the OT. There was discussions, and we worked very, very hard trying to show Medicaid that these therapies were needed. And so they have put them in the extended state plan. We did have a meeting with representative, excuse me, I'm getting my representative and my commissioners, with Commissioner Lee. I think it's still to be determined how people are going to access these therapies after it's not, Leslie's on, I know, Leslie, I don't think it's taken place yet. I don't think it actually has come to where they're actually losing the therapies as they had been. So it's still to be determined. I've had quite a few families calling me because they're concerned, because they're currently getting their therapies through their ABI provider. And if an ABI provider chooses to get a Medicaid number, which a lot of them are having, or what they're telling me, I want to be politically correct here, what they're telling me has been somewhat cumbersome. So anyway, I think it's still to be determined. I know families are on edge because if they have to start going to the different, and this is not to pull anybody out, but the court, the pro rehabs, and that's just an example, it's not to be naming them. But I'm hearing from a lot of them that they really don't intend to pick up the ABI clients. So it's caused me a lot of concern. It's not come to fruition yet. I guess Leslie can let us know where we are in the process, but yes, I've had a lot of families, and many of the smaller ABI providers are really kind of sitting on pins and needles. So anyway, it's still to be determined. And I think a lot of them are concerned because we're losing a lot of our really experienced OTs and speech therapists because they're going elsewhere, because the delivery system is going to be different. So I think that kind of gives an overview, and I'd welcome anybody, any questions or anything, if Sheila, but that's kind of an overview of what's happening right now.
And the exact cause, Mary, of this change is in the restructuring of the ABI waivers themselves?
I don't understand where they will save money. That's what I'm hearing. It was to be a cost savings. Actually, again, these are my opinions. My opinion is I think there were concerns in Medicaid that people were overutilizing services, that some of the providers were taking advantage. And I think this is kind of where it came from. Again, I could be wrong on that, but that's from my history. It was looked at because I know there was a meeting presented to Health and Welfare where there was a slide that presented how much therapies were being consumed by ABI waiver clients. And again, cognitive rehab is how our folks get better. And you know, I think that was, to me, when navigating it, I think that was one of the reasons why they did feel it'd be a cost savings.
And this, Leslie, I'll let Pam, I'm going to defer it to Pam because we have had conversations. And of course, Mary, you know, we worked on this originally back in 2014 or 15 based on CMS guidance. So Pam, I'll let you speak if that's okay.
Yeah, thanks, Leslie. So just to clarify and to just kind of to go back, the removing of the therapies didn't have anything to do with the waiver redesign, the Navigant study, it was directed by CMS. Because at the point in time that the waivers were created, we did not have the independent therapies were not in the state plan. They now are in the state plan. All of the other waivers have moved the services very successfully from the waiver to the state plan. There is a less than 1% denial rate, but this was a direction from CMS that we could lose funding if we continue to provide services through a waiver that are offered through the state plan. What we are able to do is we can cover them as extended state plan services. So if the individual would continue to need the therapies to remain out of an institution and they are can no longer be covered through the state plan, then they can come back to the waiver and can receive the therapy through the waiver. There are over 75% of the current ABI therapy providers that are already enrolled in state plan. Some of them are providing state plan services to individual that are on SCL, for example. I know there's a question about disparity in the rates between the waiver and between the state plan, but there is also a very different billing mechanism. So in state plan, it is billed based on the modality that is being done. So a provider may bill 3 to 4 different codes in, a single therapy visit, whereas in the waivers, it's a 15-minute unit and it's a generic code that's used. So you can't really look at reimbursement compared apples to apples because the billing is so different and how it's provided. As of right now, the ABI acute waiver, we have the application back. It is in a request for additional information status. So it still has to go back to CMS for review. We're planning on having that resubmitted by the end of this month, but it still will be at least an additional 90 days before we receive anything back from CMS. And as I told the providers, and we've met with several independent providers as well as had webinars, that it will not be a cutover like, okay, the waiver's approved, you have to start this tomorrow. There's going to be training that's going to be had with all the providers on the billing. And then there will be a transition period of likely probably 60 to 90 days to transition individuals from waiver to the state plan. Now, any individual coming in new, once the waiver is approved, then it would be expected that they go to state plan first. And the individuals that are in ABI acute actually already have to get physical therapy through state plan because it's not offered in the acute waiver. Now, the long-term care waiver, we are working on the final 2 updates to the financial pieces of that, and then that will go to CMS. But again, we're looking at at least another 120 days, 90 to 120 days before we have a decision on that. So there's been no change in the individual's access to the therapies outside of a meeting that was had probably 3 months or even longer with a couple providers and a couple parents. I'm not hearing any more questions. So Mary, please, if you have people reaching out to you, we need them to either through you to come to us, or we need them to call our waiver help desk or to reach out to the ABI team so that we can provide them information and allay some of their concerns and their questions.
Pam, I think you have gotten 2 or 3 calls from family members that I directed to. I think right now it's just kind of wait. I know when I've had the 2 families up there, I think is the meeting you're referring to. I think, it's the process, and I hear that. And I think it might be helpful because I didn't realize you had another meeting. I think it'd be helpful to make the TAC aware of these things. And, I think we all want this to be as seamless as possible. I just think there's a lot of, I'm trying to choose my words here. I think there's just a lot of anxiety because people have been getting services. And as I stated, one of the things you and I have talked about is cognitive rehab. And when you do cognitive rehab, it's the whole bucket. It's the occupational therapy, it's the physical therapy, it's the speech therapy, all rolled together. And I think, that's how our folks get better. And I just, I'm just looking at how we will be able to guarantee that everyone, with an interdisciplinary team are talking back and forth, and the speech therapist is talking to the case manager and all the other entities that are involved, behavioral. A lot of our folks, are seeing behavior specialists. And so it's a whole team approach. And that's what I guess I'm somewhat concerned about, is that continuity, that real interdisciplinary team approach may be lost. And again, like I said, I guess we'll just see. I know you and I had talked about in that one meeting, about having a plan of how this will work. And I think that might help some of the anxiety of how do you go from A, B, C, and then whatever. And if there are issues, how's that going to be addressed? So,
and as
I
I
think
mentioned, that will be included in the training that's done when we know closer to the date and have the transition plan. We did send out a communication to the participants and their representatives, as well as there was a different one that went out to providers, trying to allay some of the anxiety because there was a lot of incorrect information being shared. I really want to try to avoid that, because that unnecessarily creates chaos and creates concern for the participants. But we absolutely, when we know a more definitive timeline from CMS, as I mentioned, we'll have that transition period. There'll be a lot of education, both provider, we'll have webinars where people can come in basically just to ask questions like we've done with other big changes. It's just not the time to do that yet, because nothing else has changed from the last time that we sent out that information. I mean, until we hear back from CMS and know actual dates.
Could you send me a copy of that communication? I did not receive that. So if you could send me the communication that you said went out to family members, that would be helpful.
Yeah, I'll have Kelly to pull that.
That would be helpful. Thank you.
And, I think it went out on our large waiver distribution list too. So if you want to, or through the ABI list, if you want to make sure that you are on those as well. But I can have I'll have Kelly check our waiver stakeholder distribution list and if you're not on there, Mary, I'll have you added, and then we'll get a copy of those letters sent to you.
Yeah, I think that one of the issues, and I know we're all developing, but a lot of our families, and the two that I brought up with me that one day, some of these family members, the mom is, 65, 80 years old, and they call me because they just really are not computer literate to be able to navigate some of this stuff. And then when they get a letter, they just throw it in a heap. So if you can keep me as educated as possible, I will try to communicate that to some of our families who really don't have access to computers or who are not feel comfortable using that format. So that
well, and remember, the Waiver Help Desk has a 800 number that is, and I can make sure you have that is manned by staff that can answer all of those questions as well and can guide them through that. And we have, in particular, individuals within the ABI branch that also can call individuals back and can answer questions and walk through them. I think the most important, and I appreciate everything you do, Mary, and your advocacy and the people that you do help walk through when there are, because it's a difficult process to navigate. But as much as we can do just to make sure that we're all on the same page and that the message that's being communicated is clear and is across the board, that the same people are communicating the same message. I think
Well,
that will help us.
And that's why I asked for those communications to be sure that I'm getting, because that way then I can download it. And then if I have to, I'll get it to the families, whichever method is easiest for them. So that'd be, and Karen Massier, just to give a shout out. I know there's been 2 issues that she's helped me through here just recently. I think, and I do thank her for that. There were 2 big issues that she helped work through.
So as we all, let me put my psychology hat on here for a minute. In the face of change, there is always anxiety. And Pam, I think you hit the nail on the head, and Mary as well, that the more communication that we can have with the people that are going to be directly affected and with their caregivers, because in this case, as with our folks with SMI and some of our IDD folks, it's really the family members and the caregivers who have to be the eyes and ears for the people. So communication, if the TAC can in any way be helpful, the brain injury people have been a part of this TAC from its outset. We actually have 2 associations represented, the Alliance and the association. And so we're because there's so much overlap, as you know, in behavioral health with people with acquired brain injuries and those who have behavioral issues for other reasons. So if there's anything that the TAC can do, I can leave this on for our March just to see what the update has been. I guess I would have one question, Pam, and that is, do the current therapy providers, what's their process to move from for being a waiver provider to a state plan provider? Is that a separate credentialing issue?
They go through, yeah. So we have a couple staff that are in provider enrollment that have been very gracious to walk a lot of the providers through. I know there's been a couple ABI agencies that enrolled as providers. Those are the most recent ones I know. But yeah, it's you're just enrolling as another provider type.
Okay, and so you've had communications, I assume, with the providers, because it sounds
Yes.
like one of the concerns that, and I know this from my former role as a therapist, that people get very dependent on. I mean, there's a working relationship
Right.
with a particular therapist, particularly as it develops, from the time of the most acute injury or illness that's caused the brain injury or the breakdown in mental functioning. And any change in that again causes a lot of anxiety, both for the provider and for the patient and the family. So and then is there a question about the rates? I mean, it sounds like it's hard to compare. It's not
There's
apples and oranges.
I think
in
there's
terms of the rates.
a misunderstanding of how to bill. And so because today in the waiver, so for example, for occupational therapy, everything is billed with the code 97530 and 1 unit equals 15 minutes. When you look at the therapy fee schedule, it's actually broken down to by the different modalities. So each modality has a different code. And so one may be for the visit, one may be it's 30 minutes. So there's differences in how you bill, but that is part of the training that we will do to help the providers understand. And as I mentioned, it was very effective when we transitioned SCL and HCB. It worked very well. And we had additional people, that were there to support them. And, it wasn't just kind of a flip of the switch and say, okay, here you go. We were very, we even, for authorizations that were already in place, there was a period of time where those were extended and given through the state plan to give them time to get new orders. I mean, it was a very provider and member focused process. And so, we want there to be as little disruption as possible for these individuals. And I think I had mentioned that there's about 75% of the providers that provide therapy in ABI that either were already enrolled and providing some state plan services along with the therapy through ABI, or that have enrolled since this initially was discussed.
Pam, when
Okay.
you say 75% of the providers, now is that taking one entity provider who serves quite a few of our clients? Because most of the questions are coming from more of the smaller mom and pops and some individual therapists who had been contracting with them. And I think that's where some of the most concerns have been. So I think, that would be an issue. And like I said, I'm not just saying we're losing many of our skilled providers of the OT and speech. That's a fact. And that's when families, and I think Sheila hit the nail on the head, when someone has worked with somebody 5 or 6 years, they're accustomed, they know what these folks quirkiness, and I say that lovingly, but they know how to set them up. And so that's been the fear. So anything that you can help ease those fears, I think that would be good, because again, the way that you set up an individual with a brain injury to provide the OT and speech is much different, even with your SCL folks, or your more.
Well, they each have their own unique, you're gonna
Yes.
set them up differently. You're gonna
Yes.
treat somebody that has another type of injury differently. So I mean, everybody has their own unique methods that are gonna have to be followed.
Yeah, and
but-
since ours is a smaller population as far as being served, I think that's where, it's with the SCL, there are a lot more individuals in those waivers than with the ABI, and they're just not as accustomed to working with our folks. So that's why I'm just very nervous about losing some of our very skilled therapists that we have. So anything that you can help make the process better will be much appreciated.
Yeah, and if you can help the providers to know when they communicate to the individuals that it doesn't help when they tell them, I'm sorry, I'm not going to serve you after I have to go to state plan, even though I'm already enrolled as a state plan provider, it's not lucrative for me. That's just not, I mean, it may be their reality. I mean, I get it. People have to have money to do their business, but it doesn't help an individual that's already worried about what's going to happen to them. And it doesn't feel really good either to say, I don't want to help you anymore because it's not going to pay me enough money. So,
I mean, I've not heard that. If that's what you're hearing, that's not, I hear it on the other side. The therapists are very concerned that they will have to, not do this. And you're right, if they're not being able to be paid what they consider an equitable pay, they are leaving because of that reason. But if anyone's been told that, that has not come back to me, and I'm an advocate.
yeah,
And
unfortunately,
that would cause me great concern.
I was on the phone and heard it directly out of the speech therapist's mouth to the participant and their family. So
Well,
it was very unfortunate. So I've been really trying to be very intentional about the communication. I don't want to, we've been quiet for a little bit because nothing has changed. So, and maybe that's been the wrong decision, because maybe that's caused more anxiety because people aren't hearing anything. So I can talk to Kelly, and maybe we can just get an update out to individuals that say, that lets them know that,
I think that
this
would
is
be
the updated timeline.
Yeah, but I think that'd be helpful,
Yeah.
because I've had people over Christmas call me, say what's happening. So yeah, I think maybe some type, and I think, communication's the key, it just keeping people comprised of where the process is, and just, hopefully I can be part of that process of how we're going to transition, I think would be very, very helpful.
Yeah, I think so too. One final question, Pam, to you. There is a therapy TAC, TAC of OT, PT, and speech, and I wonder if you all have been in touch directly with that TAC. Their chair has changed, and I don't know the new person. It used to be Beth.
It used to be Beth Ennis, right?
Beth Ennis, and the chair is different, but Kelly Sheets and Aaron Bickers could tell you who the chair of the TAC
Yeah,
is.
and
It seems to me that communication from you all directly to that TAC would be extremely helpful
Yeah,
because that's
I
their
was,
place to gather information.
I think I think their meeting is coming up, and so I will be starting to join their meetings as I can. And I think there's one, but unless I'm
meeting is-
confused.
Sorry, Pam, their meeting's next week and their
Next
new
week, okay,
chair is
okay.
Dale Lynn.
Okay,
Yeah,
I
and I
think
think,
it's Mary Haas. Do they meet by Zoom or how do they meet?
Yes, ma'am, they're also by Zoom.
yeah, and Karen Lenz has put on here, Dale Lynn is the OT who's in charge, Lynn, DALELYNN. Thank you, Karen. If you have an email for him, that would be great. I just would recommend communicating with them, whatever you're sending out, particularly to providers, because they get the word out, those associations, the speech and hearing, the OT and the PT associations all have representatives on that therapy
Mary, if you
stack.
want to shoot me an email, I can send you a link to where you can access all the Zoom links for the therapy tax if you'd like.
Yeah, that would be great. So Mary, thank you so much for bringing up this issue. As I say, the ABI folks are very much a part of the behavioral health community, and we are always concerned about their access to services. And Pam, I very much appreciate your being on and getting Mary more into the loop of the communications. And again, if this TAC can be of help to you, we're happy to do that. And we will keep this on so in March we can get an update.
Yeah. Sheila, this is Steve Shannon.
Yeah.
I just want to echo what Mary said. I've heard similar things from consumers as well and families around this issue. They're greatly concerned. And it's unfortunate what the speech therapist said, but if that's the truth, Pam, I mean, what should have the speech therapist said? If it's not financially viable, I think we got to at least acknowledge
well,
we're going to lose some
yeah,
providers.
I think it was it was how it was communicated, the words versus, because I get it. I get it. This person also believed that they were only going to continue to build that one particular code, but just to me, saying that to a member just is not, especially an individual with a brain injury, you're not lucrative, it's not lucrative for me. I don't know. I just had a little bit, the phrasing and just how it was done, I guess just bothered me a little bit, Steve. I get it. You're right. I mean, there's a cost to do business and you have to be able to sustain your business. You're not, we don't expect people to be providing services for free. I think the way that it happened, I guess, is what really bothered me. Because I think it made that waiver participant feel like they were of less value.
I guess I'm curious. It sounds to me like one would not know at this point.
That was
Whether
the
this
other
new
point
system
too.
is going to be lucrative or not. I mean, is going to pay the same or not from the
That's
way
the
you're
other
describing
thing
it.
too, right? Because there's not and in particular, this therapist did not understand how she was going to bill. She just made the assumption she could only bill that one code. And I think it's a 30-minute. I think it may be limited to 30 minutes, or maybe, oh no, that code is just per visit. But that wouldn't be the only, that's just that one modality. So I think there's not I think people are looking at the two rate or the fee schedule for therapies and then what they're billing through the waiver and trying to make it a one-to-one comparison or apples to apples comparison. And the way you bill is completely different. So you just can't do that.
And that's where your
I think if you can share
communication and
that
your,
with me, that would be great also.
yeah, I was going to say your communication then in terms of what will be included in the training and the differences between the two would be helpful. So thank you both for your input on this, and let's keep an eye on it and hope that we can allay the anxieties so it doesn't worsen the situation and that we can hold on to the really excellent therapists that we have out there. So Thank you very much, Mary, for bringing it up. And thanks to Kat Jones with Aetna Better Health. She's confirming that Verisys is live for the credentialing with KHA and that Aetna is utilizing it. So that's really good news. And appreciate that update, Kat. So we talked, Justin Derringer from DMS is preparing a patient no-show data grid, and I have not heard from Justin whether that's up yet. Leslie or anybody else from DMS, do we know that? Do we know the status?
Yes, ma'am. Miss Schuster, how are you? It's good to see
Fine.
you again, and members of the TAC. That is in progress. We are working on that. We're hoping we probably have that by this meeting. However, it's not quite complete yet. The programmers, we've had a couple of different communication meetings and design meetings, designing the dashboard. I think it's gonna be something that's gonna be very useful to everyone, specifically for your purposes of being able to view which providers are reporting no-shows and which types of providers are having no-shows and what the reasoning is behind a lot of that no-show information. That dashboard is being created. It's going to be accessible all the time through a web page, through a link. And so that is currently being developed by the software designers, and hopefully by the next TAC meeting, we'll have that up and going, and we can, give a little demo of that and show you all how that works and how to be able to use that in the future. So it's exciting that we've got that created and or almost created. We're working on it, just not quite complete yet.
That's wonderful, Justin. Thank you so much. And let's tentatively put you on the agenda for March so you can demonstrate it. That would be great. I think we've wanted to know and make sure that people are using it in an appropriate way. For those of you who are not as familiar with this, it really is a way for kind of those social determinants of health to be addressed. So if people are not being able to keep their appointments because of transportation issues, because of childcare issues, because they lost their computer link, those kinds of things, the MCOs are trying to reach out. And we know with our behavioral health members that staying on the regular therapy and medication appointments and so forth is so critical. So we appreciate that very much, Justin, and appreciate your working on that. And we will break a bottle of champagne over the webpage or something.
Absolutely. I'm looking
when it
forward to it.
happens in March. You're
Sure.
probably ready to drink some champagne at that point. So we appreciate that very much. Thank you. And I'm wondering where we are with, again, a repetitive issue on our agenda, the claims payments for services to dual eligibles. We went around at the last meeting, and I believe that all of the MCOs now have bypass lists. And there's some talk about the creation of a uniform bypass list. So I wonder if there's been any progress on that.
Dr. Schuster, I believe someone has their hand raised.
And who is that? I can't see.
It's Nina.
Oh, Nina. Okay.
Yeah, I found my reactions buttons, and sometimes they're easier than typing in the chat. I just had a quick question for Justin. What kind of response are you getting from providers in terms of reporting the no-shows? Is it still coming in? Is it wavered? Kind of how's that all going? Because I think it's important for us to have information on an ongoing basis if the data is really going to tell us anything.
It's definitely, there's still ongoing participation. I think it's wavered a little bit, but I think that this tool to be able to be out there in public so that people can see that, to be able to react to it, use it, to know that people are actually looking at it and trying to find solutions for it. I think that will be an encouragement for providers to be able to be more active in using specifically reporting each instance and maybe being more vigilant about, because what you'll find is you'll see a lot of information from providers are going to come back and they're going to say, I don't know, as far as reasoning why the appointment was missed or unsure, unknown. And so I think this will give providers a little more incentive to maybe dig down a little deep and say, well, why exactly could you not make it? Let us know so maybe we can help with some supports in the future. And so those are the things that I think and believe that this will assist with. So
Good. Could you do me a favor and send just to Sheila so she can get out to all participants, or however is best to communicate it, just a reminder as to what we're supposed to communicate and how we're supposed to do that, just to make sure everybody's still got current information.
Absolutely.
And then of course it'll be enhanced and when the report comes out. So I would greatly appreciate that.
Yes, no problem.
Yeah, if you could
Thank
send
you.
that, that's a great idea.
Sure,
Nina.
absolutely.
Thanks, Justin. Thanks,
Yeah.
Sheila.
a
Yeah,
good idea.
Nina, you may remember because you were on the MAC at the
Mhm.
time that the MAC also is expressed, the MAC in general has expressed a great
Yes.
interest in this. And there was discussion based on a recommendation, I think, from this TAC about regular reminders to providers to
Yes.
use it. And I do agree with Justin that if we make this webpage public, that it might really sparks more interest from providers in entering
Good.
the data.
Good. I appreciate
They
that.
really-
I am still
yeah.
on the MAC representing hospitals. That's why I wanted to make sure that
Okay,
at least hospital providers are reminded again of what their responsibility is to the cabinet
yeah,
in terms
Yeah.
of reporting no shows. So thank you very much.
yeah, great. All right, thank you.
Mhm.
And now on the dual eligibles. And I don't know, Leslie, is Angie Parker on maybe? I can't remember who was, oh, it was Jennifer Dudinsky, I think, who was doing the dual eligibles issues and the bypass.
This is Jennifer, I'm on, but that wouldn't be me.
Ah, okay.
I think I had listed down that the MCOs were working on something with Angie Parker's group. Angie, are you on if I've misspoken?
Yes, I am on. And what Dr. Schuster had mentioned earlier regarding that the MCOs were all working and getting a uniform bypass list that they're all using. That was discussed in an MCO CEO meeting a few weeks ago. If any of the MCOs want to, I have not seen that final bypass list. Not to say that it's not completed. But if there's anyone from any of the MCOs that would like to discuss what they know about that.
Hi, this is Kat with Aetna. So I have been talking with Becky Bolin, our COO, who's been participating in that meeting, and she has shared with me that we're all continuing to work towards that ultimate goal of hopefully aligning on a uniform commercial bypass. So from what I understand, the current status is we haven't got there yet, but the discussion and the work continues to move towards that.
Well, that certainly is good news. Kat, you're just full of good news for us today. Thank you.
Sheila, that's what I've heard from MCOs as well on our calls.
Good.
One concern that has been raised is how will that list be used? One possibility, someone on one call said that you would, if it's on the list, you would have to submit some documentation from the commercial carrier, which CMHC representatives on that call pointed out that, that's not really a bypass list if I have to submit documentation as well. So just so you know, that's out there, and that was on a call that we had, and that was obviously a concern, that we'd have to somehow have documentation that the benefit isn't covered, which has been the issue going forward all along, right?
That makes absolutely no sense, Steve. I mean,
That's what the people said. It's a bypass list. Why have a bypass list if documentation from the commercial carrier, has to be made available, whether it's the plan itself, something off their website, any process. And this really goes back to what Mary Haas raised with the state plan that complicates billing is a real concern. So I
well,
think
and as we've
that's
said
still
so
out there
many
for us as
times,
well.
yeah, I mean,
But we're optimistic. We're cautiously optimistic that we get to a place that that list works as it does with the Medicare bypass list.
and
I
that
just wanted
list
to get insight.
is working well. Yes, go ahead.
I'm Taylor with Isaiah House, and we have seen some of the MCOs provide those denials saying that they need the commercial EOBs for those. Typically, we have been able to reach out to our provider reps and get those reprocessed and taken care of. So they are, we as well as other providers that we know of are taking it to their attention, and they are making those corrections.
Yeah, I agree, Taylor. That's taking place.
Yeah, and I would love nothing better than to be able to resolve this issue, which has been a 15 or 20-year issue, I think. It's worked well on the Medicare side. So let's keep working on it. And I appreciate the work of the MCOs.
Yeah.
Let's communicate that, because that's something that they're doing that really has come as a response, I think, to our continuing questions about this. So we do appreciate the efforts, and we will be optimistic. And this may call for several bottles of champagne. I'm obviously looking for things to celebrate here. So this would be fantastic if we could get this one done. Another cause for celebration would be if CMS has approved our waiver for SUD services to incarcerated persons. So yes, our bottles of sparkling grape juice and fun non-alcoholic mixes.
There you go.
I use champagne, Marcy, in both alcoholic and non-alcoholic sense. We'll offer choices. So Leslie, I hope you have some news and maybe some good news.
I have a little bit. I made some bullet points while I was listening. So we did turn our Kentucky 1115 demonstration in on time. I think we may have been a day early, which was good for us. That also included the SUD 1115 components, which also included the currently pending incarceration amendment, hoping that this will all be approved together. It does have a few pieces of the old Kentucky Health, such as programs related to foster care that are out of state, and waiving of medical transportation NEMT for methadone for SUD. So right now we have no additional questions. We've done everything that they've asked us to do. Most of it was budget related, and I think I told you before, it kind of came full circle as to what we recommended in the beginning. Then they asked us to check a couple other arenas, and then we came back around to what our original proposal was and just refined it, and that's what they have accepted so far. So we have no additional questions on the incarceration amendment, and like I've told you each time, we have a monthly call with them, and there are more and more requests coming in for states, but it tends to be more for just that 30-day coverage prior to release for the care coordination piece. So hopefully we'll hear something soon. CMS did add our renaming of the 1115 Kentucky demonstration of Team Kentucky. They did add that extension request for us to talk about this month on our call. And we anticipate that DMS will send questions to us prior to the call. Those usually are like at the last week of the month. So I'm hoping to get questions so that we have those prior to the call. So I don't have anything yet other than them, acknowledging that we sent the information. So, but I've always promised I will let everybody know as soon as I hear anything, because it's very exciting adventure on all levels, and so happy to be able to rename it was a really good thing for us. So.
And Leslie, while I have you, let me ask you a question that I was going to ask in new business, and that is, can you give us any kind of update on where we are with the SMI waiver?
Yes, so if you remember, and I can come back and talk to you again about this later, we had so many requests from groups and partners and sister agencies, and all these things were flooding with us, that we started making a list of everything everybody wanted. And so no stone goes left unturned, right? So I'm trying to figure out ways to put into the state plan quicker, or would that go into an 1115 and have more likely be approved by CMS, or should we go in another direction? So we did talk to CMS about doing a 1915C, Sheila, and they decided that they weren't in favor of a 1915C, but they would listen to a 1915I. So what we're going to end up with, and I think I may have shared this with Steve, we're going to end up with an 1115 with some components in it, some state plan amendments, and then also we are currently working on a 1915I for those components that were in Senate Joint Resolution 72.
Yeah.
So it's all still positive. I can tell you that we sent a draft of the 1115. We promised to send that before Christmas, and I believe I sent it on the 22nd at 4:00. So that's
Wow.
the last day of work. And I believe that's what I got it sent. So team was great. I cannot take credit for we've just got a great team, hardworking team, and they work until it's done. So it's just a draft. And they have acknowledged that they have it, and they're going to start checking it to see where gaps are. We literally had things in there that we said, we need your technical assistance now. So we told them that we need some help, and they've offered to help us with guidance on that. So draft has been sent. As soon as I get some answers back from them, Sheila, I'll start sharing if that's okay.
Yeah, absolutely. So we're really looking at a combination of 1115 with some state plan amendment features, and then a 1915I.
Yes, to waive anything, you have to have it 1115. To waive a Medicaid requirement, you have to have the 1115. To, the waiver on the 1915 C and I side's a little bit different when you're talking about that. So people get confused sometimes, but we'll have to have the 1115 to waive some of the current requirements to allow for additional services to be provided or expanded. So, and I can, like I said, if you allow me to, when I get answers back from CMS or we have our first meeting, I might have a little more information to give you. But this is all very exciting again, and we're hoping that everything works out. We are also looking at the SED side. If you remember, we're looking to do some SED components, and the SED side, we think we can get most of that done through a state plan amendment.
Yeah. And for those of you who,
sorry, the 1115 does not include any SED. We think we can do that in the state plan amendments.
Okay. So for those of you who may not know about Senate Joint Resolution 72, was really codifying, in a sense, a recommendation from the SMI task force, which met all through the summer and fall of 2021. And the recommendation was that there would be an SMI waiver that would provide supported housing and supported employment, and would also include respite services. And we've had some good discussion and presentations on this TAC about those respite services. So people getting discharged from the hospital, unfortunately, are getting discharged sometimes to the street because there's no place for them to go, and we want to keep that from happening. So I think I'm going to start just putting this on as a regular update for the TAC. Leslie.
Yes, that's fine. And I was going to say, we can meet with you separately as well.
Yeah, that
Sheila,
would be great.
Because CMS's guidance with the 1915I, we've recently had to reach, I call it the matrix, where what authority we're putting everything under, but we've really tried our best to meet the request of what everybody wants. The name may be a little bit different because that's what CMS calls it, or another state has gotten it approved under a different name and a different authority. So we've had to be creative. But yes, we hear the need, and we are very hopeful that all this will go through.
Well, we're just going to have a bunch of celebrations, I think. So thank you for that. And is Pam still on? Pam Smith?
She may have had to drop. Let me see.
I'm here. No, I'm here. I've got to drop in just a second, but I
Okay,
hadn't dropped yet.
I did have a question I wanted to ask you, and that is, can you give us an updated number on the waiting list for the 1915 waivers?
Yeah, let me see what the, I have just had to do that. And I've got so many, I've got so many windows. Sheila, let me find it and I can post it in the chat if that's okay.
That's perfect. Yeah.
Because I've got,
just-
I have too many things going on my monitors and I'm like, I can't find it really quickly.
Yeah,
So, but
yeah.
give me just a second. I'll find it and I'll post it in the chat.
Absolutely. That would
Okay.
be great. Thank you
Okay.
very much. So, anybody else have any other questions around waivers, since we've been talking waivers? And again, Leslie explained that a waiver is to waive certain requirements so that you can focus on a set population, in this case, the people with severe mental illness, and then provide services that are not typically covered under Medicaid. So we keep this issue on, this next one, number 9, about the single Medicaid formulary. And it really is a question about, are there any medication issues out there? Because we know how immensely critical it is for our folks to get the right medication and the right dosage at the right time without any delays. So I have not heard from anybody, any providers or family members in some time, but I'd like to keep it on there just to remind us how important access to medication is. So does anyone who's on the call have any concerns or questions? Because Dr. Ali has been very good about being on if we have any questions, and we can certainly get some answers. So just raise your hand or speak up.
I haven't heard very much about what's going on with the new TD drugs that are out there.
Okay.
Because they're so brand new, and I'm curious to see what kind of stuff's going on with those, if there's any difficulty in getting them. I haven't heard anything in my community about people actually taking them, but I'll be interested to know if there's any trouble getting them, because they're so brand new and things. So I'll be interested to see if anybody starts taking them, or if there's any trouble getting them or anything like that. So
Val, I can certainly email Dr. Ali and her deputy and just ask that question in terms of, are they probably are not on the PDL yet.
PDL.
Yeah, because they're so new. And so what's the process for accessing those? And maybe some of our providers have had some experience with them as well.
Yeah.
But I'm glad to ask that question for you. Okay, where are we with recurring issues around numbers and requirements for the audits? And that's Jennifer. I called you out on the wrong thing, Jennifer. Let's see if there are any, if we can get some feedback from any of our folks about whether it's better or worse or about the same.
Sheila, I think you skipped the prior auth guidance.
Well, I'm sorry. Yeah, I think that we have not had any issuance of prior auth guidance since July. Is that correct? Can somebody from DMS confirm that?
This is Angie. There has not been any changes since then.
Always good news, Angie. Thank you very much. Thank you, Steve. So now let's go to the MCO audit.
Jennifer had to drop for another meeting.
Okay.
She did say that she did not have any new information.
Okay. Thank you. And do we have, are things kind of status quo? Steve, you and Kathy Adams are typically our sources of information, but I see Julie Paxton, for instance, may have some, sense from your comp care whether, it's a problem or not.
This is Kathy, and I haven't heard much, but I think it's because of the holidays.
Okay.
So well, give us another couple of months and see if we hear any less griping about the number and frequency of audits.
Right, okay.
And I haven't heard, Sheila, this is Steve Shannon, that they seen a reduction.
Okay,
I don't know if I would hear that, but I think someone would report that. But
yeah. Well, and we want to be sure that the providers are having enough time to reply to them. I
Right.
think Jennifer made it very clear at the last meeting when we talked about it, that they all should have a 30-day window. And if, something shorter than that, the provider has every right to say, you got to give me 30 days to respond, kind of thing. So let's remind people about that as well. So we will keep that on for an updated report in March. That's why our agenda keeps getting longer and nothing gets moved off of it. So I'm hoping that we can move a couple of these things off. I put the 2023 session on just to remind you all that the legislators are back in Frankfurt. And it will be interesting to see what there is that will come up around behavioral health issues generally. The budget is kind of open, even though this isn't a budget session. There was some talk about opening up the budget for additional help to Eastern Kentucky, particularly around housing, which was not really addressed in the special session. And we know that there are any number of people and families still being housed at, maybe some still at state parks, but a number in very temporary camping tent kinds of things, or, small RVs and that kind of thing. So just a reminder, if you're interested in advocacy, that they will go home probably after Friday session, and then they're home for a month. So if you have issues that you're working on behalf of your organization or for yourself, that's a super good time to be in touch with them, because they're home from January 6th to February 7th. So they are literally home for a month. Now that they've all been sworn in, so that the 30 new legislators look a little bit less like deer caught in the headlights. They've had their ethics training. We'll have had, Steve, 250, 300 bills introduced this week to plow through. But it's a great time to catch them at home, particularly 25 new House members, 6 new senators that may not know a single thing about behavioral health issues. So if you're working on something, that really is the time, I think, to gear up in terms of issues around mental health, substance use disorders, and acquired brain injury. And Pam, thank you very much for posting the waiting list numbers in the chat, and appreciate your being on. Anybody else? Steve, you want to add anything about the session one way or the other? Or?
I don't think so. I mean, it's, they're kind of just getting started, and bills have been filed, obviously, but we're hearing there may be fewer bills this session. We're going to try to keep the number low, but we'll see if that happens or not.
Yeah.
And Dr. Schuster, Bart Baldwin has his hand raised.
Oh, Bart, yeah.
Yeah. Hi, Sheila. Thank you. Just wanted to touch base. You'd mentioned the relief for housing for Eastern Kentucky. Just wanted to mention that, working with the Homeless and Housing Coalition of Kentucky, and they, along with others, are requesting $100 million put into and creating a disaster affordable housing fund. We have an ongoing affordable housing fund that's funded at much lower than that on an annual basis, but there is push from multiple groups to create something, given our recent history, the last with floods and tornadoes and floods again, and in terms of getting a vehicle to be able to get funding for housing to folks when they need it. Because you're right, we still don't have that addressed at all at Eastern Kentucky in any meaningful. I mean, a little bit here and there, but not in a broad way. So there will be plenty of push to at least open the budget to do that, but we'll see.
Yeah, I'm glad that you brought that up, because I think that, I think the motto now is housing is health. And it
Yes.
absolutely is. And I think the Coalition for the Homeless in Louisville is saying that, and certainly the statewide organization, the Homeless and Housing Coalition of Kentucky, is making that pitch. And actually, you all may remember in the special session that Senator Brandon Smith was practically in tears on the Senate floor talking about, you've put some money in. That was the special session that was called to send some money to Eastern Kentucky. He said, but you've not touched housing. And so I think there still needs to be that, we need to return there. Yeah. Natalie says, "It's across the street." Yeah. Across the street.
Absolutely.
Well, and that's
Absolutely.
where, the SMI waiver is all about housing, because we know that if we give those supports to people that have chronic, lifelong disabilities and keep them out of trouble and keep them access to their medications and to therapies and so forth, they have a much better chance of, being where they need to be. So thank you very much for that. So we'll come back in March and kind of give some update about some specific legislation, but just wanted to remind you that this is a great time coming up here in the next month, literally, to talk to your legislators. So if nobody else has anything else to add on that, we will go on to the recommendation that was made. Actually, a 3-part recommendation that we made in November, and I just got notification 2 days ago from the Department for Medicaid Services that all of this is in process with a completion date of January 31st. And that is that we would have a listing of all the benefits and services for mental health provided to adults and children, similar to the one that the primary care TAC is doing for SUD services, that it would have input from each of the managed care organizations. And I was on a different meeting, I guess that was Tuesday morning, where all the MCOs had submitted their information and it's being put into a grid. So I think it's actually going to happen. Val, I know you had lots of questions about this and making sure that it was consumer friendly in terms of the language and so forth. But really would be nice to have that side by side where you can really compare the various services and the ancillary services. And I know that some of the MCOs have been very creative and generous in offering other things to members to help them with some of those social determinants of health, cell phone, for instance, and some other things. So we want to be able to highlight that. So I was very pleased with the response from DMS, because in every instance, they said the anticipated completion date is January 31st, 2023. So we're coming up on that. So hopefully we'll have something that I can send out to you all. So appreciate that. Let me ask the voting members of the TAC if there are any new recommendations that you would like to make for the MAC meeting that's coming up on January 26th.
This is Mary Haas. I don't have anything right at this time.
Okay, Mary, thank you.
Mary, would it make sense to make one about that communication piece on the therapies?
Well, thank you, Steve. I think that would be helpful. Now that I said, now that you're talking about it, I think that would be helpful.
What would you suggest, Steve?
That DMS does communicate with the brain injury associations as information is shared with both providers and individuals served. Does that work for you, Mary?
That would be good. I think that'd be helpful because the last entity that Pam was talking about, I did not remember receiving that. So I think that would be helpful. So we can go ahead and do that.
How about a friendly amendment for me that they would communicate not only with the two brain injury associations, but also with the BH TAC and the
Yeah.
therapies TAC?
Yes. Yes.
What about
Okay.
the client rights tag?
Consumer rights?
Consumer rights and client needs, I think, right?
Yeah. Okay.
I mean, it sounds like that's the plan for Medicaid anyway. They're going to agree to do that. Let's just,
Let's formalize it.
yes.
So the recommendation to the MAC is that DMS share any communications around changes to the, how do we want to describe that?
Therapies within the brain injury waivers, right, Mary?
Right, and as they transfer over to the extended state plan, what is the process? Because Pam admitted that they hadn't really communicated anything, they were still waiting. That was when we had the meeting about 3 months ago. They said they were going to wait until it actually happened. To me, I think you should be planning now before you actually, it goes into effect. We're hearing 90 days, 120 days. I'd like to see what is the plan, and then we can kind of look at it and see if there's any holes or any entities that need to be taken care of. I think sharing with the providers, and also there's quite a few contract, I shouldn't say quite a few, there are some contract therapists. So anybody that's currently contracting therapies with two ABI providers, participants, that they also ought to be informed. Because the one that Pam referred to was probably, I don't know who she was speaking of, but I would think that was probably an independent contractor. So I think those folks ought to, and I think those are the ones that are kind of missing. I think the neuros and some of your bigger providers are getting information. I think it's the more mom and pops and some independent contractors that aren't getting the information. Or at least they're telling me they're not getting the information.
Okay, so what we want to recommend is that when DMS makes communications regarding this change in therapies from the ABI waivers to the state plan amendment, that those communications would be shared with all ABI providers, regardless of including individuals, small groups and large organizations, the
Right.
ABI participants, the two brain injury associations, the BH TAC, the therapies TAC, and the consumer rights TAC.
Yeah, I think that's pretty encompassing.
Was that your motion, Mary?
Yes, it is.
And
As long-
Steve, you want to
I will
second
second that motion. It's very good.
All right. Any discussion or questions from the voting members of the TAC? All right. All those in favor of making that recommendation at the next MAC meeting signify by saying aye.
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 Anyone opposed? Any abstentions? All right. Thank you very much. That's a team effort there. So we'll make that recommendation. Kelly, can you put up on the screen the sheet that has the next meeting dates for the TAC and the MAC?
Because we're in the conference room, I don't have that available.
Okay,
I
that's
can
fine.
email it out to you.
This TAC is the 26th.
Yeah, I tried to put it in, all the groups that I communicate with. But
Yeah.
if you could make that available, in fact, does it make sense to actually put that on the website? Do they want that kind of thing?
So you're asking for the next TAC meeting, for all of the TAC meetings for the year?
Yeah,
Okay,
yes, please.
that's on the webpage.
Okay, good.
So
We
So
have
our
had some
next-
publishing issues, Dr. Schuster. Our main web guru, for a better lack of word, retired. And so the person taking over has been working on getting things published. So all of your new TAC dates are on your behavioral health website, and all the MACs are on the MAC page. I know some of them have been a little delayed in getting published. So I do apologize about that. We are trying to work with our OATS team. As you know, there's 17 TACs, and so every time I update, I think I'm not their favorite person right now. So, but we are trying to get all those published and updated. So they should hopefully within the next few days be getting all of those, because I did the last couple of weeks of December update every TAC page to be published. So again, I'm hoping that they're not gonna, push me down in the hallway because I'm their least favorite person right now, but we're trying to get all that stuff published and pushed through for you guys.
Yeah,
And we
I
did send a
appreciate that.
calendar invite to you guys. So you should have something on your calendar with the Zoom link for the rest of the year. If you didn't get it,
Perfect.
shoot it an email and we'll send it back out to you.
Okay, that's great. Thank you very much. I know Tim checks for me all the time, and so he will email me and say, oh, the agenda's not up there yet, because I don't usually go to the website to check. So appreciate that. We have a lot of carryover items for the March meeting, and hopefully we'll have the Medicaid data study at that point. We'll keep the ABI waiver issues on, the no-show data development. We'll keep asking about the services for dual eligibles and the creation of the uniform bypass list. We'll keep the update on the SUD waiver for incarcerated persons, and then we'll add the SMI waiver as a regular issue. Of course, we always ask about medications and prior authorization.
Dr. Schuster, Nina's hand is raised.
Oh, Nina, yes.
Yes, thank you. You skipped new business, so I just wanted to say something real quickly.
Yeah, I haven't gotten there yet. I was on 16
Oh.
recommended agenda items for the March 9th meeting.
Oh, never mind. I'll be
All right, we'll get to you in a minute here, Nina. Thank you. So I don't know that everything we're doing is old business, it feels like, because we keep the same issues on. So does anybody have any old business things that we have talked about in the past that somehow have escaped our agenda? Now we'll go to new business, Nina. And you're on.
Thank you. Just real quickly, I had communicated to the cabinet about the BHSO AODE rates for fee-for-service. And Leanne Fitzpatrick got right back with me, and I just wanted to tell you all that the cabinet has confirmed that the new fee schedules will probably not be posted right away, but they are effective as of January 1, 2023. And so whenever they're posted, they'll be posted on the DMS website when they're complete, but they do go back to 1/1/23. And that's all.
Thank you, because Kathy Adams, you had that question, I think, didn't you?
Yes, we had asked DMS before Christmas when they were anticipating filing or posting the new fee schedules for BHSOs and behavioral health MSGs. and had been given the date of January 2nd. And so now our members are up in arms going, where are they? Where are they? So if there is anybody from DMS that can provide an estimated time frame for when they will be posted, it would be most helpful.
This is Leslie. Just talked to Ann this morning. We're hoping to have by the end of January. We did have some delays over the holidays, and not just the holidays. We just had delays getting the information together. So just in general. So we're hoping for January 31st.
And can you,
Leslie, would you mind emailing me when they're posted? Can I
Yeah,
ask you
that'd
to
be
do
fine.
that? Okay. And then I can let everybody know, because I've got
Mhm.
everybody. And again, if you want to get things directly from me for the BH TAC, just send me an email at kyadvocacy@gmail.com. Appreciate that. Appreciate that update, Nina, and we'll get those fees posted. For those of you who didn't look at the chat, and appreciate Pam Smith. The Michelle P. waiting list is 7,908 persons. 7,908. I think that's maybe actually down, Steve. I think it was up at 10,000 at one point.
Maybe.
Maybe not. Maybe it was 10,000 altogether.
Mhm.
SCL is a total of 3,059, where the no emergency, 122 urgent, and then the remainder, 2,937 are future planning. So those are the two big chunks. And I assume that means that there's no waiting list, Mary, for any of the ABI waivers?
I haven't had any communication on the waiting list for over 9 to 12 months, so I don't know.
There's no waiting list on the two ABIs.
Wow, okay, because it always seemed like there was waiting lists usually for one, but not for the other. The acute
Yeah,
maybe.
there was a waiting list for the acute. So there's nobody waiting for acute services, Leslie?
Sorry, I was trying to get back to my mute button. I don't believe there was any. We just had a meeting a couple of weeks ago and there was no one waiting at the time on either one. I can double check that, Mary.
Thank you.
Yeah, I would think that Pam would have put it in there because she had gone back to her sources to put this in the chat before she had to leave the meeting. So if you hear something different, Leslie, if you'd let me know that.
I will. If you don't hear back from me though, just assume we don't, because I'm pretty sure just as a week or so ago, we did not have anybody on those two waiting list.
Okay. So, yeah, it still is, it's a bad situation to have all these people on the waiting list, particularly 122 urgent.
Mhm.
And remind me, Steve, you may know this, what's the difference between emergency and urgent? Is it a time frame thing?
Leslie Hoffman. You wanna
Yeah,
answer
I'm
that?
trying to remember back in the day. I think one of them might need future help like within 5 years, and one is
Right.
like, yeah, within the year, or urgent is probably less, year or less is probably what I'm thinking.
Yeah,
Is there
emergency
something
is
about loss of caregiver? Isn't there something
Yeah.
about loss of
Yeah, I
caregiver?
might,
loss of
sorry,
caregiver,
I'm a little
risk of
rusty on it.
institutionalization. Yeah.
Okay.
Dr. Schuster, Nina's hand is raised again.
Oh, Nina?
I put it in the chat box, but I did reach out to Nancy Galvani at, President of KJ, and she said the provider credentialing is not yet live, but very close.
Oh, okay. So a little bit different than what Kat had said from Aetna. So maybe
Right.
some of the MCOs are getting geared up for that. Did you tell Nancy that we're all very anxious for it to get going?
I did. I did. That's why she said we're really close.
Okay. I appreciate that. the next MAC meeting, and again, we'll send out that, or the Zoom link will be on the website. I really think that it's worth attending via Zoom, the MAC meetings. You get probably as good an overview of Medicaid when you hear both the presentations that the commissioner makes and the various questions that continue on the agenda. And then when you hear what the TACs are working on, there's a lot of dovetailing, obviously, and the ABI therapies is a good example of that. A lot of dovetailing between that therapy TAC from that perspective, from the provider's perspective, and then our perspective from the maybe more the patient or member perspective. But I think it's a great way to really get updated, and you can sit in the comfort of your home with your with your feet up and listen to that. And then our next BH TAC meeting again is March 9th, and we will meet at 2 because they will be in session, and we will wait for them to finish their committee meetings and go into House. Okay, Kat says, I apologize for the confusion. To clarify, we are using Verisys in the KHA specific form has not yet gone live, as Nina identified. Thank you, Kat. I appreciate your input, and Nina, yours as well.
Dr. Schuster, we have Kelly Gunning with her hand raised.
Yes, Kelly, welcome.
Hi, thank you. I don't know if this is the appropriate entity, but I still have some lingering questions, and I have concerns because it's another third or fourth party entity being added into our service array mix here in Kentucky. And I haven't heard anything. Of course, I've been really ill, but I haven't heard anything about the RFP for an administrative service organization for crisis services in Kentucky. And I was wondering what the implications are going to be for that going forward for our providers, for administration, for another entity and all of that. I don't know if this is the appropriate entity to bring it up, but I have real concerns about that, obviously, going forward as another third or fourth party we're going to have to work through. And just wonder if there are any updates or if this is an appropriate forum to discuss that.
Kelly, this is Leslie. You can reach out to me individually. Of course, with RFP, we're not able to speak about things right now, so you can reach out to me individually if that's okay.
Is the RFP out is my question.
No.
Okay, thank you.
I'm sorry, what was the question?
Is the RFP for an ASO out yet? And it is not.
Thank you, Leslie.
I wondered though, because I agree with Kelly that this has, I think, significant implications. We've talked with the secretary directly about it. And Leslie, I can't remember, there's been 2 series of presentations. One was to the CMHCs on a meeting that Commissioner Morris called, that somebody from DMS did a PowerPoint on what the thinking was and what the model was. And that same presentation was made to the 988 coalition. Do you know what I'm talking about?
Leanne, I think, did the one to the 988, and I probably did the one with the secretary's office.
Yeah.
Yeah.
That's why I'm just wondering, could we get a presion?
I was just going to say,
you don't know anything about this, and it has huge implications.
Yeah.
Is it appropriate for us to, I mean, I do think the topic, and I don't want to get into the RFP, but
I don't either, just the topic.
That PowerPoint presentation, I think, lays out, the goal and
yeah, I have a simple one that that they've okayed for me to share, so I can send that one. Do you want me to send it to you, Sheila?
Well, what I'm wondering is, yeah, why don't you send it to me and let me send it out, and let's tentatively put a follow-up on in the March meeting. Now, at that point, you may not be able to say anything, but for people to have an opportunity to ask questions and so forth. And I do think that we are an appropriate forum for that discussion.
Yeah. Thank you for answering that question, Sheila, because I don't feel like it's being vetted appropriately. And I also don't feel like our CMHCs and our local communities have been given the same opportunity to respond. I mean, if we're going to put it out on RFP, that means we're willing to pay for crisis service coordination and whatever else ASOs do. And why aren't we offering that same effort to our local entities? That's my question. It's a philosophical question as much as anything. I mean, when the RFP comes out, it's public knowledge, we can all read that. But what I'm trying to ask is, you know, I don't understand the philosophy behind it at all.
So again, I don't want to get into conversation on this call. I can send you.
I got you,
Yeah.
Leslie. And
So
I've talked with Secretary Friedlander, and he's aware of my concerns, but I don't think this has been widely vetted among our community. I know certainly I've talked to various individuals who know nothing about it. So I would like
we did a year-long planning grant. There's a 260-page needs assessment where we met with everybody for 3 months. So that was a planning grant that ended in September. So now we're moving forward with trying to do implementation and funding. So that's where we are right now. And I will tell you that this is a huge endeavor. It's not just one piece. The ASO would be looking over lots of things. So
yeah, but I'm not sure that's, again, sorry, philosophical discussion.
Yeah.
And Dr. Schuster, Bart Baldwin has his hand raised as well.
Bart?
Yeah, thank you, Dr. Schuster. And this falls under new business. I'm not sure if we moved past that or not, but and this is something that I did not.
Hold on one second, Bart. If it's not about the crisis services, let me wrap that for just a second. Okay.
Yes,
hold your thought.
absolutely. Absolutely. Sorry about that.
Leslie, you're going to send me the PowerPoint. I will send it out to the voting members of the TAC and, you know, the broad range of people that I have in my database that typically attend. And we will put this on the agenda for March, not to talk about the RFP, obviously, but to field questions.
And we have a website that I think I've shared that link before. And I think I might have shared the needs assessment. It's huge. You can't just email it around, but it is on our website. So I'll send you the website and then the PowerPoint. And
Wonderful.
The website has some basic information that I'm going to send you in that PowerPoint already. It's already out there.
Okay. So thank you.
And the planning grants out there.
Yeah. Thank you, Kelly, for bringing that up. We'll get that information from Leslie and I'll get it out to you all. So now, Bart, thank you for your patience. Let's move on to you with another new business issue.
Sure, absolutely. And yeah, and this is just an issue, Sheila, it actually just came to my attention within the last couple of days, and I just got another email about it while we were on the TAC. And this just happens to be the perfect group to bring it up with in terms of with providers, Medicaid, and the MCOs. And so I'm not asking for a solution, but I was notified, and just verification, that there's 2 extended service codes for individual therapy. So if a session goes longer than an hour, then you bill another code. And then if it goes longer, you bill a third code. And from a provider has reached out and said that the AMA has deleted these 2 codes from the CPT code book. So, so if you have a session that goes longer, you don't have that option to go longer than 1 hour for an individual therapy session. So I just wanted to put it out there. Sheila, it's probably something good to have for our agenda for the next TAC. But if there's any information on this that Medicaid folks have, or MCOs, I mean, I'm assuming that she's gotten some notification from the AMA, so I'm assuming this is all accurate. But I just think that's a concern for treatment in a lot of areas, and this would obviously go across multiple provider types.
Right.
And that was totally news to me. So I thought, well, this, when I first got it, I thought, well, the behavioral health TAC would be a good one, but then I got another email while we're on it. So I thought I'd just bring it up to see as a point of discussion, if anybody has any information on it that would be helpful. And if not, we can certainly have it as an agenda item for the next TAC.
Yeah. And I don't know, Leslie, who at DMS would be the person to provide information on this?
Sorry, and this is related to two codes that we think are going to be deleted. Is that right?
Right.
Robert?
Yeah, I mean, I can give you the codes if you want, but
Yeah,
I
why
don't
don't
know
you
that
send me
have.
an email? I probably,
Sure.
and Justin may still be on here. We'll go from there.
Okay.
Yeah, and would you
I just
copy me, Bart, please?
Sure. I just wanted to bring it up since we had Medicaid and providers and MCOs kind of all on the same call that this is,
Yeah, Cat.
yeah, there we go.
Jones, yeah, has them in the 99354 and 99357.
Yeah, I've got 355 for the second one, but okay. So that's something that you are aware of that's happened.
Sorry, I was trying to get off mute.
Sorry.
So I just became aware and found the AMA updates, but that's as far as I know anything about this. Is that I literally just within the last week came across that, scanning the new updates, the AMA updates, and saw that. But other than that, that's that series that I put in the chat. So that would be 9935455. That's the series.
Yes.
Okay, and it goes up to
Yeah, so
57
that's all I
probably.
know, but I know it's utilized frequently, and I think that's if I don't know why it was deleted, but it could be an issue that we're all going to have to figure out a way to deal with.
So does it include 54, 55, 56, and 57? Is that what I'm hearing?
Correct. That's
Four codes.
Oh, I'm sorry.
Okay.
No, go ahead, Kat.
That's the information that I'm seeing in the AMA, the article about the AMA updates for 2023.
Thank you.
And Dr. Hannah has his hand raised from Passport.
Okay, David?
Yeah, I was just going to say, we just became aware of this issue this week, and, we're going to continue to follow the fee schedule that DMS has published, but I know that everybody's concerned about being in alignment with national coding standards, and so it is of concern.
Yes. Yeah. So I guess my request is obviously this is breaking news, so to speak. Although it's effective 1/1/23, so it's already been in effect. But any type of guidance that we could get, Leslie, for providers and MCOs. I hate to throw another thing on your plate, but and I don't really have any idea the rationale behind it. I haven't read the article, or seen anything. It's
Okay.
just.
Yeah, I'll get with Justin and then I'll also get with Angie Parker.
Okay, yeah, because I think you're going to run into providers getting concerns of getting rejected on some standard practice, standard billing that they've been doing for a long time, and so.
And Kat, was the AMA update? Did that come out this week?
That's when I became aware of it, but it sounds like that's what maybe the other MCOs are just becoming aware of that too. It looks like from what I'm reading, there may be a substitute for those codes. So I just need to educate myself a little bit.
Okay,
and read this more.
Yeah, the 99417 looks like they're a new code, but it's not really a replacement. What I'm reading, it might help, but that doesn't really truly replace it. So
right, we'll have to educate and learn more about this for sure.
Yeah, Stuart Owen from WellCare has put in the chat 99218 as a substitute.
Yeah, I just saw an article. There's a link there to the article. It goes into 99217 and 218. And just from quickly scanning, it looks like those are the substitute codes, but there's an article addressing it.
Oh, okay. So is that a solution, you think, Stuart, or you don't know?
That's my 30-second review. So yes, that's it.
Okay, great.
And that's,
I think it is though, but
I can tell you that Anthem is just going to stick to the current Medicaid fee schedule and how current contracts are aligned.
Thank you. I appreciate that. It looks like that article is from the family practice organization, which is interesting. It's a little bit different than the AMA. I mean, they're physicians, but it's not the
Right.
AMA.
Right.
And I don't know if other organizations could just come up with substitutes on their own. I don't know how this all works. But
I think the change is actually at the national coding level. I don't think it's, a change specific to any single group.
Okay. So AMA was told by the national coding group that this change was going to be in effect, and they're just spreading the word.
No, I think the AMA kind of tells the national code.
I was going to say the
Yeah,
AMA.
but I don't think it's just the, family medicine or
Yeah.
the information I had came directly from, whatever the Coding Association's website is.
Okay. Yeah, this sounds, Leslie, like something that would be helpful if you could get some information that we could get out before our next March meeting. In terms of what DMS is doing with this new information, whether it affects.
Grabbing all this out of the chat, and I'm sending an email now so we can get started with the discussions, Sheila.
Okay, great. Thank you very much, Bart, although
Yeah.
that's the kind of breaking news that's not good news, so.
I know, I'm killing the celebration vibe that we had going earlier. I apologize.
Yeah, we had a little bit of a celebration going, Bart, so.
Sorry.
Yeah.
Sorry. Yeah, it never
but-
lasts, So, but anyway, but I just thought this is the group that would be most impacted and interested by
Yeah,
this. So I wanted to at least
Absolutely,
get
yeah,
it going.
No champagne for you then.
yeah,
Okay.
and no grape juice either, so. No
We'll stick with
substitute.
coffee.
We're gonna substitute grape juice. No substitute for you, Bart. Okay. So,
Dr. Schuster?
yeah,
If I may, this is Erin. Before we end the meeting, I just wanted to send a quick reminder. With your all's next meeting being March 9th, I may or may not be here with you guys. So I'm gonna have Kelly drop her email in the chat. That way, if anybody has any questions, TAC related business, if you could go ahead and just start getting in the habit of copying her and sending her emails. That way, if I'm not here by your next meeting and she's running solo, you have a way to contact her.
yeah, I appreciate that, Erin, and we will be anxious to hear if you're not with us, how things have gone. We wish you the very, very best with your baby coming. And we'll look forward to hearing the good news. Another cause for celebration. And Marcy's reminding us that Mental Health Month is May and the kickoff is April 28th from MHA Kentucky. So, all right. Anything else that anybody wants to share? I was trying to give you all lots of time back, but as it turns out, just a few minutes, but you have a few minutes of your day. And I do appreciate the participation of everyone. I think we had over 90 people on the Zoom at one point. So I love having a big tent and having lots of interested people under it and lots of committed advocates and providers and consumers and so forth. So Happy New Year to you all. And I look forward to seeing you in March, if not before. So thank you very much. And we will
Thank you.
New Year.
adjourn the
Thank you.
meeting.
Take care, everyone.
Thanks. Bye-bye.